that you brought up at lunch has to do with the dementia patient.
Right.
Who,
Right.
if they don't, if they're not going to take advantage of the time that they have where they're still lucid, and write down the things that they need to, it leaves the family, because someone like Alzheimer's, we're 15 years, 10 years, 20 years sometimes into that process. And it's so much easier if you've got an idea at the onset what you would like to have done.
Mm-hmm. One of the things that it came up in the conversation on physician-assisted suicide is that somebody with dementia isn't really going to be able to take advantage of that. And they're not going to, because they're not terminal at the time that they're still competent to make decisions and capable of making their needs known. So a couple of things that might be valuable and helpful to them is what kind of care do I want? If I have dementia and I'm no longer capable of enjoying life, do I want to have a feeding tube? Do I want to have, if I'm having some difficulty swallowing, do I want them to stop feeding me by mouth and putting in a tube directly into my stomach? Because if we do that, there's a good chance that we can make that person's life extend for potentially many years. And is that something that they want? I mean, if it's something that they want, I certainly can accept that they've made that decision. But there's a lot of folks who feel almost resentful that they can't make a decision to end their life in advance by saying in advance, this is what I want down the road, because that's the way that the law has been set up, and I'm actually okay with that. Others might not. I know you're not. Others might not be, but at the end of the day, things that would cause your demise that we frequently will continue to do in spite of the fact that may be their way to exit. I'll give you a quick example. Mm-hmm. One, it's about feeding people, and that's the hardest one because that's how we nurture each other. I mean, I could be a classic Jewish grandmother in terms of making lots of food and being very happy that people are eating. Eat, please, have some more. That kind of thing.
Exactly. Or an Italian grandmother. Right. Yes, I mean, they're all over the place.
Exactly. So that's how we take care of each other. But if someone is no longer enjoying life, no longer participating in life in the way that they felt appropriate, are they able to exit that way? Are they able to say, you know what, don't continue to feed me, or don't put a feeding tube in? Food is for enjoyment. I want to still be able to taste. That's one issue.
Yeah, but if you're going into Alzheimer's and 2 years down the line you become an advanced patient, you're no longer able to verbalize that, Michael. No. So that's
you've got to put that down.
You've got to put it down.
You have to write that down in some format that others know that you have written it down, and you share with the people that you love that are going to be the ones most difficult. Everybody knows who's going to be the problem.
Problems, yes.
Everybody knows in the family who's going to be the one that says, oh no, you must continue to feed them, that you must put a feeding tube in, you must. And you don't have to. The other thing is about antibiotics. Continuing to treat somebody's UTI or continuing to treat a respiratory infection and continuing to do that with a wide range of antibiotics,
Michael,
and
pneumonia.
continue to bringing them back is not necessarily something that I personally would want. I would want to be kept comfortable, so I would want to have good pain management, keep me comfortable, keep me clean and comfortable and all that stuff. But the fact is that if you keep rescuing me when I'm no longer capable of enjoying life, that's a problem. Now, this is all subjective, not objective, subjective from the standpoint of somebody could be very pleasantly confused and be fun to be around and not have a problem whatsoever. Lindbergh and I have a very dear friend. I'm not going to name names, but basically someone who had a fair amount of confusion, not early signs of dementia, maybe a little bit further along, but just a joy to be around.
Yeah.
But can't remember yesterday or what she had for breakfast this morning. That's not important to her. The fact that she still can participate in life is important to her. But at the end of the day, what's it going to look like 10 years from now for her? she's going to need an awful lot of care and attention. Maybe she doesn't. Maybe she'd be fine with that. I don't know. But these are things that are very personal to the people that we deal with all the time.
Right. Yeah.
They need to know that they have a choice in the matter.
Well, but the fear, Michael, is if I find out what my demise is going to be, I'm going to be terrified and I don't want to read it. I don't want to know about it. If it happens, it happens. I mean, that's the attitude with a lot of the disease process. Don't tell me how I'm going to go. But all we have to do in our society is look around us. Your neighbor, your grandmother, your cousin, whoever is involved with, especially if it's a genetic problem. We can't close our eyes to that. So if we're brave enough to pick up the information that's available and really look at it honestly and make some decisions, please put it in writing. It's critical. Absolutely critical. And unfortunately, with a disease like Alzheimer's, you can't tell people what you want.
No, you can't. And at the end of the day, we see people who are very advanced, who are still capable of eating, and they do want to eat, and they're able to accept food, and there may be some enjoyment from that standpoint that they still are having that. But would their former self want to be in that position? I don't know. But if it matters to you, if this stuff matters to you and you don't write it down, there's a good chance that you won't have any control over that.
Well, you won't. Not with that disease process.
No.
And you know, ALS and MS are also two diseases. Advanced Parkinson's. These are diseases that you get to a point where you are not really participating. So if you were to think about it, what is it that you want? How is it that you want to exit? And we need to have conversation about that. When my husband was diagnosed, Christmas Eve, one of the first things we did was call up our attorney. And we said, we need to review everything. We need to look at what we've done, how we've set up our will, our trust, our pulsed, our durable, everything. We laid it out on the table and we had an open and honest discussion about it. That was number one. It was critical for he and I to take that action. Now, the other things that we're doing is we're making plans. We're talking about going to England. We're talking about having dinner parties with close friends so that they can come here and he can enjoy the camaraderie and conversation. We're adjusting our lives, but we're being extremely realistic about it. We're not burying our head.
You have to. I mean, if sometimes when people don't deal with these things, they become very emotional. It's very upsetting to them, and they don't want to deal with it. And so it's better to just sweep it under the rug and not address it. When the reality is that when you get these things done, when you revisit these things and you are finished with that thing, you set it aside. It's done.
Yes.
You don't have to bring it up again unless there's something that changes. And a lot of times people don't address any of this stuff. I find it fascinating, and I work in a hospital doing hospice and seeing hospice patients and seeing people who are very advanced age, and I have people in their 90s who. People 95 years old. I'm sorry. I think that they should absolutely have funeral arrangements made.
Yes.
They should have, at the very, very least, they should say, I wish to be buried, or I wish to be cremated, or donate my body.
Exactly.
I don't care anything else, but they should at least have that done.
Yes.
But I find people who don't.
They don't.
I'm thinking, were you going to live forever?
Yeah.
I guess so.
Yeah. Well, in their mind, they are.
Or they've just said, my family will take care of that.
Right.
And family's not even prepared. They're not even aware. Well, gosh, what did grandma want? Or
because you're always asked, Michael. You're asked in the hospital.
Yeah.
How do you want us to handle this, Mr. So-and-so? Your parent is, or your child is in an advanced state of disease. Why not learn a little bit?
Yeah.